Hi, this is Eric True, CEO of Digital Dental Leaders, and I want to share with you another one of our digital training resources that we have on our website. This one's called Good Scans versus Bad Scans, and our goal here is just to help you understand what are some of the common problems that we see with digital scans and help you avoid those. So the first one is anterior scans. When you're taking a scan of an anterior in the anterior region, and let's say we're restoring tooth number 7, it really is important that you capture in your scan tooth number 10. So the contralateral side is really important for us to see to get you a result that's more natural and fits the patient's face. You don't have to take a full arch scan, though that can be helpful, especially for function. A quadrant scan or a scan of the anterior region is fine as long as we capture enough for both the function and the aesthetics of that case. The next one is margins. So on your margins, as you can imagine, it's critical that we can see all of the margin clearly. And so if there's tissue over the margin, which is probably what we see the most when it comes to marginal errors, look for tissue that's covering it, look from different angles, turn your color off, turn your color on, and be sure to get us a margin that's clearly visible all the way around. The next one is in the area of the contacts, the adjacent contacts of the teeth. If you'll just check from different angles, it's hard to capture it, and then it's also hard sometimes to notice if you've missed data. And so all the way through as you scan and then before you send it, check and make sure that there isn't any missing information on the adjacent contacts. And the same thing with the next one is the contacts, but the draw of the contacts. This is one that I'm particularly passionate about because I think it'll really help you and help your patients. One of the areas that's really important in the mouth for restoration, as you know, are the breadth of those contacts and having the right kind of gingival embrasures to avoid food traps. So we show you pictures of implant scan bodies because we actually see this on implant cases most often, where the angle of the contacts doesn't help us, number one, get the crown seated, but it also then opens up embrasures and causes food traps. So just watch for that. But you can also watch for that on a single tooth preparation. You know, we look for parallelism on bridges so that they'll draw. But also just remember to check the adjacent contacts so that they'll draw. So check your parallelism in more than just a bridge preparation, also on the adjacent contacts. The next one is the scan bodies. When you're scanning a scan body, the most critical portion to capture is the top of it. So it shows us how high or how deep the implant is and then what the position is, so the flat side or the beveled edge on the scan body. It's important to capture more the rest of the scan body as well, but if there are incomplete areas between that top portion and the gingiva or the tissue, it's not as critical. But be sure to check and make sure it's the same size, the proportions are right on the scan body scans. And then the last one is the bite scans. Just get us a good thorough bite scan, because sometimes what will happen is that the software won't line up the bite correctly and we need to manually adjust it. And if we just have very limited data on the bite scan, it makes it very difficult to do that. Well, if you need more information or more help, you can call us, you can email us, text us. We'd love to help in any way we can. Our goal is to see you have a great result for you, your practice, your patients, and we appreciate the opportunity of getting to work with you.